hospitals across the state are bearing the brunt of this latest surge, with reports of ICU beds in short supply and the number of sick going up. We wanted to see it firsthand. Conway Regional gave our Cassandra Webb exclusive access. And Cassandra, the situation is only going to get worse before it gets better.
Yeah, Lori, you might remember a few months ago, the COVID situation at Conway Regional actually got better, and they were able to close one of those COVID-19 floors. But unfortunately, that floor is open again, and what was a step forward just now feels like 2 steps back.
At the height of the pandemic in 2020, there were about 43 COVID-19 patients behind these doors. But then things got better, and one COVID floor sat empty. But that didn't last long.
It was like a gut punch to have to consider opening up those units.
Census-wise, we're roughly back to where we were last year, kind of in the midst of everything.
Nurse Hannah Ray has been on the front lines since the beginning. She says what's different this go around is the ages of the patients they're treating. The average age, younger than 60.
That affects us mentally and emotionally a little bit different than it did last year, because these patients that I'm treating now are taking care of now are closer to my age.
Since June 1st, 88% of Conway Regional's COVID patients were not vaccinated.
While this is our calling, this is what we are made to do, it's still a challenge, and it's still something that wears on people, particularly when you know that this is preventable by getting a vaccine.
All COVID units open again, and they've had to expand care into their rehab hospital.
And that's probably the most gut-wrenching part of this. These are all things that we could easily prevent if we as a community came together and did the right thing.
Nurses like Hannah are encouraging everyone to get the vaccine, and meanwhile, still willing and ready to serve.
Now, Conway Regional says the small number of COVID patients who have been vaccinated tend to have less symptoms and are less ill or critically ill than those who are not vaccinated.